today's topic is posology. The word posology is derived from the Greek word posos, meaning how much, and logos, meaning science. So posology is a branch of medical science which deals with the dose or a quantity of a drug which can be administered to a patient to get the desired pharmacological action. This is posology. It's nothing but a science which mainly deals with the dose. Factors affecting posology. There are so many factors are needed to be considered while designing a dose for a patient. First factor is the age. The pharmacokinetics of many drugs changes with the age. So while determining a dose of a drug, the age of an individual is of great influence. Children and old people need less amount of dose of drug than the normal adult dose. Why? Because means they are unable to excrete the drug to that extent as adults. Children can be tolerated relatively large amount of belladonna, distalis and ethanol, whereas elder patients are sensitive to some drugs like hypnotics, tranquilizers. Next factor is gender. Women do not always respond to the action of drugs in the same manner as that of men. Morphine, barbiturates produces more excitements before sedation in women. So special care should be taken when drugs are administered during the mother care, menstruation, pregnancy, lactation. There are certain drugs which are administered to the mother are able to cross the placenta and affect the fetus. Example, barbiturates, alcohols, narcotic analgesics. So special care should be taken while designing a drug dose for a patient like women. Next factor is body weight. The average dose is mentioned either in terms of mg per kg body weight or as a total single dose for an adult weighing between 50 to 100 kg. However, the dose expressed in this fashion may not apply in case of obese patients, children and malnutrition patients. Dose of a drug should be calculated according to the body weight. Route of administration. Drug effectiveness is controlled by route of administration. This is also taken into consideration while designing a dose for a patient. So IV dose of a drugs are usually smaller than the oral doses because the drugs administered intravenously enters the bloodstreams directly. Due to this reason, the onset of a drug action is quicker with the IV route, and this may enhances the chances of drug toxicity. So this is taken into consideration while designing a dose for a patient. Time of administration. The presence of a food in a stomach delays the absorption of a drug. Drugs are more rapidly absorbed from the empty stomach actually. So the amount of the drug which is very effective when taken before a meal may not be that much effective when taken during or after meal. The irritating drugs are better tolerated if administered after meal. Example, iron, arsenic, cod liver oil always taken after meal. Environmental factors. Environmental factors also influences the dose of a drug. Daylight is stimulant, enhancing the effect of stimulating drugs and diminishing the effect of hypnotics. Darkness is sedative. Hypnotics are more effective at night. The amount of barbiturates required to produce sleep during daytime is much higher than the dose required to produce sleep at night. Emotional factors. The personality and the behavior of a physician may influence the effect of a drug which are intended for use in psychomatic disorders. Females are more emotional than the man. So this is also taken into consideration while designing a dose for a patient. Presence of a disease. This is the another factor which influences the drug effect. Drugs like barbiturates may produce unusual prolonged effects in patients having liver cirrhosis. Streptomycin is excreted mainly by the kidney, may produce toxic if the kidney of a patient is not working properly. Accumulation. Accumulation means the drugs which are slowly excreted may build up a sufficient high concentration in the body and produces a toxic symptoms. This phenomena is known as accumulation. If the drug is repeatedly administered for a long times, example distolis, emitting heavy metals, this may cause accumulating effects in the body. Next one is additive effect. This is the another factor needed to consider while designing a dose. When the total pharmacological action of two or more drugs administered together is equivalent to sum of their individual pharmacological actions, the phenomena is called additive effect. Example, ephedrine and aminophylline in treatment of bronchial asthma. It is nothing but a combination therapy. Synergism. When two or more drugs are used in combination, their action is increased. This phenomena is called synergism. According to the produced pharmacological actions, we will decide the dose. Antagonism. When the action of a drug is opposed by the other drug on the same pharmacological system is known as drug antagonism. The use of antagonistic responses to the drug is valuable in treatment of poisoning. Example, milk of magnesia is given in acid poisoning. The alkaline effect of the milk of magnesia substitutes the acid poisoning. Idiosyncrasy. An extraordinary response to a drug which is different from its characteristic pharmacological action is called idiosyncrasy. The word idiosyncrasy is replaced by the term drug allergy. It's nothing but a drug allergic conditions. Example, small quantities of aspirin may cause a gastric hemorrhage, and small quantities of quinine produces a ringing in the ear. If any patient is allergic or idiosyncratic, so this is also taken into consideration while designing a drug for a patient. Tolerance. When an unusually large doses of a drug is required to elicit an effect ordinarily produced by a normal therapeutic dose of a drug, the phenomena is called tolerance to the drug. That is, if a drug is used continuously by the patient, all the receptors in the system get tolerated to the particular drug. As a result, they will give normal therapeutic effects, even in large doses also. Example, smokers can tolerate to nicotine, alcoholics can tolerate large amount of alcohols, like that. Metabolic disturbances. Changes in water electrolyte balance and acid-base balance, body temperature, physiological factors may modify the effect of drugs. Example, salicylates reduces body temperature only in case an individual has rise in body temperature. They have no antipyretic effect if body has normal temperature. There are so many formulas used in the calculation of pediatric doses. Clark's formula, Dealing's formula, Fred's formula, Young's formula, Cowling's formula. First formula is Clark's formula. Here child dose is equal to weight in lbs by 150 into adult dose. Similarly, child dose can be calculated according to the weight of a body. That is, child dose is equal to weight in kgs by 70 into adult dose. So based on the weight of a patient, we will calculate the child dose. Dealing's formula, it is used for calculating dose of a child from 12 to 20 years of age. Fred's formula is used for calculating dose of an infant up to 24 months of age. Young's formula is used for calculating dose of a child from 1 to 2 years of age. So calculations based on body surface area. So based on the body surface area also we can able to calculate the dose of a patient. Here are some examples of some problems that how to calculate a dose for a child. So based on the formulas we can calculate the dose. So here I gave two examples. Thank you for watching this video. Please subscribe our channel for more videos.